Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. This is a guideline for utilizing the material given to you for reviewing your answers. You must have already reviewed the answers by now, and if they are, these are some of the guidelines that I would like you to continue with. Now the EMQs, if I take it, it has 20 questions. The first set of questions is on pregnancy and infections. You can read through the guidelines on pregnancy and infections in any of the hospital guidelines that we have given you. And the answers are very straightforward, and you can go through that. And the second set of questions that we have given you are based on pregnancy and cardiac disease. Again, there is a guideline on heart disease in pregnancy, and I think you should go through that. And again, the answers are very straightforward. And what you need to do, so these guidelines, you must master them at the end of the week, if you can. And that will be a very great help for you all, because in the long run you will know that in and out. Okay. The third set of questions are based on ovarian tumor, and quite a good description is given in the answer set itself, and the pathological classification of ovarian tumors have been very clearly dealt with in the question 15 explanation. So go through that, but don't forget to go through the main ovarian tumor management and identification guidelines that is already in your Dropbox. And the fourth set of questions is on carcinoma of endometrium. So there are two sets of questions which are based on oncology, and you must go through that. And then once you do that, you will realize that you have covered a fair amount of the oncology, and being thorough with it by managing such patients is the best way. And I again try to remind you that you should use these guidelines in your own practice in order to understand how the practice is in the UK, because your exam is aligned to the UK practice, sorry. Now I will turn around to SBAs, and the SBA sets are very straightforward, and I think you should first few questions are on neonatal resuscitation, and again there is a set of guidelines on neonatal resuscitation and neonatal problems, especially neonatal. Is the fourth question is on also on neonatal resuscitation, and so is the fifth. The sixth question deals with common neonatal problems, especially skin disorders, and you probably can, the explanation given there is more than enough for you to know for temporarily. You can read about neonatal problems as a subject in the guidelines again. If you don't find any, I will post some on the net for you. Amniotic fluid embolism is very clearly dealt with in the guidelines, so you should know that, and that's one of the postpartum complications. So you could go through the postpartum complications as a subject, which is the subject of the questions in the next 5 questions. And fetal hydrops is a separate subject, and you must read that, and it comes under the classification of fetal disease. But I think you will find it under fetal hydrops itself, hydrops hevitalis, as a subject in the guidelines. Malpresentations, again a common and a very simple subject, and generally these questions are straightforward, practical questions, so you should be able to know from your own practice. Again, preterm labor is being asked in the next few questions. In preterm labor, there is a very good guideline on the Brighton and Sussex University Hospital guidelines. Please go through that. And pre-labor rupture of membranes is another subject which can come because it's quite a common occurrence in the British practice. Yeah? And next subject is on induction of labor. And induction of labor also has a guideline among the hospital guidelines. Please go through them. Again, another practical question on poor progress of labor has been given to you. I don't want to go through the explanations that is written already, so I think you should read that and try to understand. If you do not, and after finishing that, go back and read the complete guidelines on those subjects. Then fetal, there is one on electronic fetal monitoring, which actually is very important because fetal monitoring guidelines, and I'm going to give you some additional guidelines that were recently released at the FIGO meeting, and that will be on the Dropbox, and you should go through that thoroughly. It's a very clear guideline from the FIGO. This you can add this on to the fetal monitoring guidelines that is in the hospital, Brighton and Sussex, and in Hartland's hospital guidelines. Then there is another one on cesarean section, which I'm sure you are very familiar with cesarean sections, and one more on fetal complications. Actually, it's fetal distress in labor, and following the about the you're given a choice of multiple choice of the one that is very likely to cause increased incidence of acidosis in the second stage of labor, and of this the answer has been the routine use of maternal oxygen therapy is a very new finding, that so you must be careful that most of the answers are very close to getting you trapped into unless you know the correct answer. So this particular question will actually put one fact in your mind, which is actually the routine, the commonest or the most common of the routine administration of oxygen, which is not done anymore, can be a risk, will lead to a risk of causing acidosis in the newborn. So there are 20 questions in the SBA and the 20 in the EMQ. I hope you scored them well. And I'm going to give you some guideline in a separate video of how to for you to use the guidelines that I have given, and please write into me. I'll be including a summary of articles from the talks which are of importance. You will find that there's a lot of learning material that will be available. That is your learning base database. These questions are only for you to be stimulated every week. Go through the questions, but most of the studying must be done using either the guidelines or the database, and mark them out, and then generally you will find this is a best way to progress. I'll keep in touch with you in terms of how you are progressing in your studies, and that's what's most important. And I'm sure within 1 or 2 weeks you will start picking up. And you know quite a number of the subject. It's not the knowledge, it's the fine-tuning of the knowledge that you have that is important. Good luck to you. Assalamu alaikum.